Gonorrhea, gonorrhea, gonorrhea. Why is it that now we are more concerned about this gonorrhea thing? Now, we have what we call superbug gonorrhea or gonorrhea superbug, or what we call super gonorrhea. It is really rocking in Kenya now, particularly in Nairobi, major cities. It is a concern because we call it gonorrhea superbug or superbug gonorrhea or super gonorrhea because of its multi-drug resistance. And we should be able to know that gonorrhea is caused by a gram-negative bacteria called Neisseria gonorrhoeae, which is sexually transmitted. It's an STD or an STI. You can only get this through sexual intercourse or even through anal sex, oral sex, or vaginal sex. Now, when you have a superbug gonorrhea or super gonorrhea, it is more or less presentation like gonorrhea per se, the one we normally know. But this is now slightly different because of its high end level of resistance to almost all drugs. In fact, I've been following this keenly, and I got that Kenya Medical Research Institute, that is KEMRI, did a very wonderful job in terms of a research over a period of 2 years in 269 commercial sex workers, and they did find a drug resistant gonorrhea, the so-called gonorrhea superbug or super gonorrhea. Among this research that they did, among these 269 commercial sex workers, they did find one to be resistant in just that sample frame they took. Meaning what? Meaning we have the superbug roaming in Kenya. We have the superbug roaming in Kenya, and we should be very vigilant and to be alert, because they also reported that they tried to do tests. There are very many tests that we are supposed to know when they are performing, that is now their job. But among the 17 drugs they used, no drug was sensitive to this particular superbug. And even now they are asking questions now, what is the next step? What is the next step that we should be doing? Because almost all classes of drugs, name them: sulfonamides resistance, penicillins resistance, macrolides resistance. There is no sensitivity in all these classes of drugs that we normally use in treating gonorrhea. But according to WHO, there is a reason. In fact, there are 5 candid better reasons why we have what we call super gonorrhea. Super gonorrhea. Now, these reasons are the one that we should be able to look keenly and deviate from them, because one of them is unrestricted access to antimicrobials. Kenyans normally abuse antibiotics. In fact, if you normally watch movies in the United States and even in Kenya, Kenyans just go to the pharmacy or chemist and buy drugs anyhow without even proper prescriptions, provided that they are feeling sick. And if they are sick, the first thing they think of is antibiotics. So this one also play a role in resistance of this particular disease in terms of drugs. Number 2, inappropriate selection and overuse of antibiotics. And this one normally occurs because if a person comes to the hospital and probably this person has been diagnosed with only malaria, and you hear them asking you, why Daktari, why is there not antibiotics in my prescription? So if we overuse these antibiotics with no good candid reasons, we form resistance to most of them, and that's why we have the super gonorrhea. Now, suboptimal quality of antibiotics. I know drugs should be passing through channels, but because of corruption, some drugs are approved and they are not up to the standard that are supposed to be. So this one also play a very important role in this particular resistance. What we call inherent genetic mutation within the organism itself. Because of the three issues that I've talked about, mutation, the organism, the Neisseria gonorrhoeae is just mutating by itself, changing the structures and adapting to all these drugs that now even if you administer them, there is no treatment, there is no cure for you. So we must be very vigilant because mutation is real. Even HIV is mutating. That's why getting a specific drug for HIV is very, very difficult. We just only suppress the virus, but we don't treat. So super gonorrhea has mutated and now there is no drug. And the last one is co-infections of the part that normally is affected. Co-infection with Chlamydia trachomatis. If you have not watched my video about Chlamydia trachomatis, kindly watch that video because it's very, very important. Co-infection at the places, particularly in men who sex men, MSM, those normally practice oral or anal sex, because you know with gonorrhea it can affect even your eyes, it can affect the child during delivery, it can affect your throat and your anus and your anus and your anus. So men sexing men, they normally use anus and or even the oral mucosa, and this normally deposits this particular organism there, and then they also mutate with the co-infection because of the infections that they get there. For example, what I've mentioned about Chlamydia trachomatis. Now, what can we do? What can we really do? Because now it is resistant. There is no drug. In fact, if you watch that video from K24, the Cambridge guy is asking now, is asking the interviewer that now what do we do if all the classes of drugs have been tried and there is no treatment? So what can we do as a nation, as Kenyans, starting with you watching me? We normally say ABC. ABC. ABC will be key till the end of time. Abstain. 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 Guys watching me, abstain from sexual intercourse. You should not do it. If you are not married, wait till you are married. If you want to do it, don't do it. Be faithful to your only one single partner. Are you faithful? The one you're watching, are you really faithful? Be faithful to your partner. Do not cheat, because you will be bringing these mutated strains to yourself, and this is where we have the superbug. Use condom. Use condom. If you must perform sexual intercourse, use condom. Then the government also should pull resources, and the pharmacy and poison board, they should be very, very vigilant in all these chemists, so that you do not buy any antibiotics over the counter with no proper with no prescription from either clinical officer, nurse, medical officer, or even a qualified health practitioner by the law that is allowed to prescribe drugs. And I think this one will really reduce this super gonorrhea or gonorrhea superbug. And also the government should put in place mechanisms of identifying generic drugs that are not authorized in Kenya, because we have loopholes everywhere. Drugs coming from different angles, different kinds of countries, they do not pass the KEB standard, and they are being supplied in different different chemists at a very, very cheaper price. So you buy cheap drugs and then it gets mutated and you have superbug. So let's be keen and let's be practicing ABC. If you love this video, kindly guys, click the notification bell, written subscribe, turn it on for more videos that we will post, and always be on the alert because gonorrhea, which is called gonorrhea superbug or super gonorrhea, is on its way coming. Muchas